Question 1. In assessing a patient with acute chest pain, which of the following should be prioritized to determine the likelihood of a myocardial infarction? Am I A. Assessing for elevated blood pressure. B. Obtaining a 12-lead ECG. C. Reviewing the patient's previous medical history. D. Assessing the patient's anxiety level. Answer: B. Obtaining a 12-lead ECG. Rationale: a 12-lead ECG is the gold standard in diagnosing a myocardial infarction and must be prioritized to detect any cardiac abnormalities. While blood pressure and medical history are important, an ECG provides immediate diagnostic information. Anxiety assessment is less critical in this context. Question 2. When confronted with a patient who refuses a life-saving treatment due to religious beliefs, how should a nurse proceed to ensure ethical and legal compliance? A. Administer the treatment over the patient's objection to save their life. B. Honor the patient's decision, document the refusal, and consult with ethics committee. C. Ignore the refusal and proceed as the treatment is deemed necessary. D. Attempt to convince the patient by explaining the benefits of the treatment again. Answer: B. Honor the patient's decision, document the refusal, and consult with ethics committee. Rationale: respecting patient autonomy is crucial, even in life-threatening situations. The nurse should document the refusal and consult the ethics committee to ensure the decision aligns with legal and institutional policies. Administering treatment against the patients will violate ethical and legal principles. Question 3. During a clinical shift, a nurse is informed that a patient's pain level has worsened despite receiving the prescribed opioid dose. What is the next best step in managing this situation? A. Administer a higher dose of the prescribed opioid immediately. B. Assess the patient for other potential causes of pain and inform the physician. C. Discontinue the opioid and use alternative pain management methods. D. Offer the patient non-pharmacological interventions and wait for the next scheduled dose. Answer: B. Assess the patient for other potential causes of pain and inform the physician. Rationale: it is critical to reassess the patient's condition before escalating the opioid dose. Other causes of pain, e.g. inflammation, infection, should be explored, and the physician should be consulted. Immediate dose escalation may not be the safest approach without further assessment. Question 4. In a scenario where a nurse is tasked with prioritizing multiple patients, which of the following patients should be given the highest priority for intervention? A. A postoperative patient with mild nausea and vomiting. B. A patient with chest pain who is experiencing shortness of breath. C. A patient with a mild fever following surgery. D. A patient with a stable chronic condition requesting pain medication. Answer: B. A patient with chest pain who is experiencing shortness of breath. Rationale: the patient with chest pain and shortness of breath should be prioritized because these symptoms may indicate a life-threatening condition, such as a myocardial infarction or pulmonary embolism. The other patients have less immediate or critical needs. Question 5. A nurse is assessing a patient who has just been admitted to the ICU after a stroke. The patient is unable to follow commands, but is alert and oriented. What should be the nurse's primary focus in the early stages of care? A. Monitoring the patient for signs of increasing intracranial pressure. B. Administering a sedative to ensure the patient remains calm. C. Encouraging the patient to perform range of motion exercises. D. Providing speech therapy and initiating communication tools. Answer: A. Monitoring the patient for signs of increasing intracranial pressure. Rationale: early monitoring for signs of increased intracranial pressure, ICP, is crucial in stroke patients to prevent further brain damage. While sedatives, physical therapy, and speech therapy are important, ensuring stable intracranial pressure is the immediate priority. Question 6. A nurse caring for a critically ill patient notices that the patient's family is consistently requesting information about the prognosis, but the healthcare team has not yet reached a consensus. What should the nurse do in this situation? A. Provide the family with all available information about the patient's prognosis. B. Inform the family that the healthcare team has not made any decisions yet. C. Hold a meeting with the family to explain the situation and provide emotional support. D. Tell the family that you are not allowed to discuss prognosis at this time. Answer. C. Hold a meeting with the family to explain the situation and provide emotional support. Rationale. Effective communication is crucial. The nurse should acknowledge the family's concerns and provide emotional support, while also clarifying that the healthcare team is still assessing the situation. Transparency and empathy are key in this challenging scenario. Question 7. In a situation where a patient presents with sepsis, which of the following interventions should the nurse prioritize first? A. Administering IV fluids. B. Drawing blood cultures before starting antibiotics. C. Initiating broad-spectrum antibiotics immediately. D. Applying oxygen therapy. Answer. C. Initiating broad-spectrum antibiotics immediately. Rationale. Sepsis is a medical emergency, and broad-spectrum antibiotics should be administered as soon as possible, ideally within the first hour. Drawing blood cultures is also important, but should not delay antibiotic administration. IV fluids and oxygen therapy are essential, but come after antibiotics in priority. Question 8. A nurse is working with a patient who has a history of substance abuse and is now being treated for an opioid overdose. The patient becomes agitated and uncooperative. What is the most appropriate intervention? A. Use physical restraints to ensure the patient's safety. B. Administer a higher dose of naloxone to reverse the overdose. C. Provide reassurance and maintain a calm, non-confrontational demeanor. D. Administer an anxiolytic to reduce agitation. Answer. C. Provide reassurance and maintain a calm, non-confrontational demeanor. Rationale. Maintaining a calm and supportive approach is crucial when dealing with agitation in patients with a history of substance abuse. Physical restraints and medication adjustments should be avoided unless absolutely necessary, as they can escalate the situation. Question 9. In a case where a patient is non-compliant with their prescribed treatment regimen for diabetes, what is the nurse's next best step? A. Confront the patient and demand an explanation for non-compliance. B. Reinforce the importance of adherence and explore potential barriers. C. Notify the physician immediately about the patient's noncompliance. D. Document the patient's noncompliance and take no further action. Answer. B. Reinforce the importance of adherence and explore potential barriers. Rationale. The nurse should approach the situation with empathy, focusing on understanding why the patient is noncompliant and addressing any barriers to adherence, e.g., financial issues, lack of understanding. Confronting or simply documenting without intervention is not helpful. Question 10. When a nurse encounters a situation where a patient's family insists on pursuing a treatment that the healthcare team deems futile, what is the best course of action? A. Proceed with the family's wishes despite the team's recommendations. B. Suggest the family seek a second opinion from another healthcare provider. C. Respectfully explain the team's decision and involve the ethics committee. D. Encourage the family to discuss their concerns directly with the physician. Answer: C. Respectfully explain the team's decision and involve the ethics committee. Rationale: when faced with a conflict between the healthcare team and the family, it is important to have a respectful discussion and involve the ethics committee to help mediate and ensure that the decision is in the best interest of the patient. Question 11. In managing a patient with multi-system organ failure, what is the nurse's primary goal during the first 24 hours of care? A. Administering analgesics to manage pain. B. Preventing further organ damage through supportive measures. C. Initiating dialysis for kidney support. D. Scheduling family counseling sessions. Answer: B. Preventing further organ damage through supportive measures. Rationale: in multi-system organ failure, preventing further damage to the organs is the priority. Supportive care, including oxygen, fluid management, and monitoring vital signs, is crucial in the first 24 hours. Pain management and dialysis are secondary interventions. Question 12. A patient is admitted with suspected bacterial meningitis. Which action should the nurse prioritize to prevent complications? A. Administering IV antibiotics immediately after collecting a sample for culture. B. Restricting the patient's fluids to prevent cerebral edema. C. Providing pain relief and sedatives to manage discomfort. D. Encouraging the patient to remain mobile to avoid muscle stiffness. Answer: A. Administering IV antibiotics immediately after collecting a sample for culture. Rationale: early administration of antibiotics is essential in suspected bacterial meningitis to prevent complications like brain damage. Fluid restriction and sedatives are not recommended at this stage. Encouraging mobility is contraindicated in meningitis. Question 13. In a situation where a nurse suspects that a patient may be experiencing sepsis, but no definitive signs are present, what is the best approach? A. Wait for further symptoms to develop before taking action. B. Administer broad-spectrum antibiotics and monitor the patient closely. C. Notify the physician immediately and request sepsis protocol activation. D. Reassess the patient every 2 hours and document findings. Answer: C. Notify the physician immediately and request sepsis protocol activation. Rationale: early recognition and treatment of sepsis are critical. If sepsis is suspected, immediate communication with the physician and activation of the sepsis protocol ensures timely intervention. Waiting for symptoms or just monitoring is inadequate. Question 14. A critically ill patient is receiving a high dose of corticosteroids for inflammation. Which of the following complications should the nurse be most vigilant about? A. Acute respiratory distress syndrome, ARDS. B. Hyperglycemia. C. Hypertension. D. Hypokalemia. Answer: B. Hyperglycemia. Rationale: corticosteroids are known to increase blood glucose levels, leading to hyperglycemia. Although ARDS, hypertension, and hypokalemia are concerns, hyperglycemia is the most commonly observed side effect of high-dose corticosteroid therapy. Question 15. A nurse is caring for a patient with a ventilator-associated pneumonia, VAP. Which intervention has the highest priority in preventing VAP? A. Elevating the head of the bed to 30 to 45 degrees. B. Administering antibiotics within an hour of diagnosis. C. Ensuring proper oral care and suctioning of secretions. D. Providing sedation to keep the patient comfortable. Answer: C. Ensuring proper oral care and suctioning of secretions. Rationale: oral care and suctioning are essential in preventing VAP by reducing the risk of aspiration. Elevating the head of the bed and timely antibiotics are also important, but proper oral hygiene is the most effective intervention. Question 16. A nurse notices that a post-surgical patient is exhibiting signs of acute confusion. What is the first action the nurse should take? A. Administer a sedative to calm the patient. B. Reassess the patient's vital signs and oxygen levels. C. Notify the physician and document the symptoms. D. Increase the patient's fluid intake to improve hydration. Answer. B. Reassess the patient's vital signs and oxygen levels. Rationale. Acute confusion can be caused by hypoxia, electrolyte imbalances, or other physiological issues. Reassessing vital signs and oxygenation should be the priority to rule out these causes before considering other interventions. Question 17. In managing a patient who has undergone a liver transplant, what is the most critical action to prevent rejection? A. Administering immunosuppressive medications as prescribed. B. Monitoring the patient's renal function closely. C. Maintaining a low-sodium diet to prevent fluid retention. D. Ensuring strict isolation to prevent infection. Answer. A. Administering immunosuppressive medications as prescribed. Rationale. Immunosuppressive medications are crucial to prevent organ rejection in transplant patients. Monitoring renal function, controlling sodium intake, and preventing infection are also important, but secondary to immunosuppression. Question 18. A nurse is assessing a patient with a history of severe allergic reactions. The patient suddenly develops difficulty breathing and wheezing. What is the nurse's immediate action? A. Administer the prescribed epinephrine injection. B. Call for a rapid response team and wait for assistance. C. Place the patient in a sitting position and reassure them. D. Give the patient oxygen via a nasal cannula and monitor. Answer. A. Administer the prescribed epinephrine injection. Rationale. In cases of anaphylaxis, the immediate administration of epinephrine is life-saving and should not be delayed. Calling for help and other measures are important, but secondary to providing epinephrine. Question 19. A nurse caring for a pediatric patient with severe dehydration notices a decrease in the patient's urine output despite IV fluid administration. What is the next step? A. Increase the rate of IV fluid administration. B. Notify the physician immediately to consider further interventions. C. Administer a diuretic to promote urine output. D. Document the decrease and continue to monitor. Answer. B. Notify the physician immediately to consider further interventions. Rationale. A decrease in urine output despite IV fluid administration indicates possible renal failure or other complications. Immediate physician notification is necessary for further evaluation and management. Increasing fluids without physician input may not be effective or safe. Question 20. A patient in the ICU is showing signs of developing compartment syndrome after a femur fracture. Which intervention should be prioritized? A. Administering pain medications to manage discomfort. B. Elevating the affected limb to reduce swelling. C. Performing a fasciotomy to relieve pressure. D. Applying a cold compress to the affected area. Answer. C. Performing a fasciotomy to relieve pressure. Rationale. Compartment syndrome requires immediate surgical intervention, typically a fasciotomy, to relieve the pressure and prevent permanent damage to muscles and nerves. Elevation and pain control are important, but should not delay surgical intervention. Question 21. In a scenario where a nurse suspects that a patient is intentionally harming themselves, what is the most appropriate action to take? A. Confront the patient directly about the suspected self-harm. B. Provide a safe, non-judgmental space for the patient to express feelings. C. Report the situation to the physician and document the findings. D. Restrict the patient's movements to prevent self-harm. Answer. B. Provide a safe, non-judgmental space for the patient to express feelings. Rationale. Creating a safe, supportive environment allows the patient to express their feelings and can lead to identification of underlying causes. Confrontation or restrictions may escalate the situation and hinder therapeutic communication. Question 22. A nurse is caring for a patient who is at risk for deep vein thrombosis, DVT. What intervention is most effective in reducing this risk? A. Administering anticoagulant medication as prescribed. B. Encouraging the patient to remain immobile to conserve energy. C. Elevating the legs to promote circulation. D. Massaging the patient's legs to improve blood flow. Answer. A. Administering anticoagulant medication as prescribed. Rationale. Anticoagulant medications, such as heparin, are the most effective intervention in preventing DVT by reducing blood clot formation. Other options, such as elevating the legs, are adjuncts, but do not have the same impact on clot prevention. Question 23. A nurse is caring for a patient who is suspected of having an acute stroke. What is the most critical first step in management? A. Administering thrombolytic therapy as soon as possible. B. Obtaining a CT scan to confirm the diagnosis. C. Initiating intravenous fluids to maintain hydration. D. Assessing the patient's Glasgow Coma Scale GCS score. Answer. B. Obtaining a CT scan to confirm the diagnosis. Rationale. A CT scan is critical to differentiate between ischemic and hemorrhagic stroke, as thrombolytic therapy is only appropriate for ischemic stroke. Early intervention is key, but a correct diagnosis is paramount before treatment. Question 24. A nurse is monitoring a patient who is receiving a blood transfusion and begins showing signs of a transfusion reaction, fever, chills. What is the first action? A. Continue the transfusion and inform the physician later. B. Stop the transfusion immediately and notify the physician. C. Administer antipyretics to alleviate fever and continue the transfusion. D. Document the symptoms and monitor the patient for 15 minutes. Answer. B. Stop the transfusion immediately and notify the physician. Rationale. The first action in a transfusion reaction is to stop the transfusion immediately to prevent further complications. Notifying the physician is critical for further management. Administering medication or continuing the transfusion is inappropriate in this scenario. Question 25. In a situation where a nurse notices a sudden drop in a patient's oxygen saturation levels, what is the most critical next step? A. Administer supplemental oxygen. B. Check for kinks in the oxygen tubing. C. Notify the physician about the change in condition. D. Increase the oxygen flow rate immediately. Answer. A. Administer supplemental oxygen. Rationale. Administering supplemental oxygen is the immediate intervention to improve oxygenation. Checking tubing and notifying the physician are important, but secondary steps. Increasing the oxygen flow rate should be done only after ensuring the tubing is clear. Question 26. A patient is diagnosed with acute pancreatitis. What is the most critical priority in nursing care? A. Administering IV fluids to maintain hydration. B. Encouraging oral intake to prevent dehydration. C. Monitoring for signs of hyperglycemia. D. Assessing for complications like hypovolemic shock. Answer: A. Administering IV fluids to maintain hydration. Rationale: acute pancreatitis leads to significant fluid loss, and IV fluid administration is the most important intervention to maintain blood volume and prevent shock. Monitoring glucose and shock signs are also important, but secondary. Question 27. What is the most critical factor to consider when managing a patient with severe burns covering 40% of their body? A. Administering pain medications immediately. B. Ensuring adequate fluid resuscitation. C. Preventing infection by applying topical antibiotics. D. Monitoring the patient's temperature closely. Answer: B. Ensuring adequate fluid resuscitation. Rationale: fluid resuscitation is the most crucial step in managing burn patients to prevent hypovolemic shock and organ failure. Pain management and infection control are important, but secondary to restoring circulating blood volume. Question 28. A nurse is caring for a post-operative patient who is developing signs of a pulmonary embolism, PE. What should the nurse do first? A. Administer anticoagulants immediately. B. Place the patient in a high Fowler's position to improve breathing. C. Prepare for a CT scan to confirm PE. D. Monitor the patient's vital signs and oxygen saturation. Answer: B. Place the patient in a high Fowler's position to improve breathing. Rationale: placing the patient in a high Fowler's position improves oxygenation and facilitates breathing. Immediate action to support respiratory function is the priority, followed by further diagnostic and therapeutic interventions. Question 29. A nurse is caring for a patient who has been newly diagnosed with dementia. What is the first step in developing an individualized care plan? A. Assessing the patient's cognitive abilities using standardized testing. B. Consulting with the patient's family about their wishes and preferences. C. Developing a detailed schedule for daily activities. D. Providing the patient with written materials about the diagnosis. Answer: B. Consulting with the patient's family about their wishes and preferences. Rationale: in dementia care, family input is critical for understanding the patient's baseline, preferences, and wishes. Cognitive assessments and activity planning are important, but secondary to understanding the patient's values. Question 30. A nurse is caring for a patient with a history of recurrent urinary tract infections, UTIs. What should be the primary focus in the care plan? A. Prescribing long-term antibiotics to prevent further infections. B. Educating the patient on proper hygiene and fluid intake. C. Scheduling regular urinary cultures to monitor infection recurrence. D. Administering pain medications to manage discomfort during urination. Answer: B. Educating the patient on proper hygiene and fluid intake. Rationale: preventing UTIs through patient education on hygiene and hydration is the most effective long-term strategy. Long-term antibiotics and routine cultures can be part of the plan, but education is the cornerstone of prevention. Question 31. A nurse is administering intravenous potassium to a patient. Which of the following actions should be prioritized to prevent complications? A. Administer the potassium rapidly to correct the imbalance. B. Monitor the patient for signs of hyperkalemia during administration. C. Use a large bore IV catheter for the infusion. D. Administer the potassium with a diuretic to promote excretion. Answer: B. Monitor the patient for signs of hyperkalemia during administration. Rationale: potassium infusions can cause hyperkalemia, which can be fatal if not monitored. Rapid infusion can cause serious complications, such as cardiac arrhythmias. The nurse should monitor for signs of hyperkalemia and follow the proper infusion guidelines. Question 32. A critically ill patient receiving broad-spectrum antibiotics develops diarrhea and fever. What is the most likely cause, and how should it be addressed? A. The patient may have developed a Clostridium difficile infection, which should be treated with metronidazole or vancomycin. B. The patient is experiencing a normal side effect of antibiotics, and no action is necessary. C. The patient should be immediately started on a new broad-spectrum antibiotic regimen. D. The diarrhea is likely related to dehydration. Administer fluids and wait for the symptoms to resolve. Answer. A. The patient may have developed a Clostridium difficile infection, which should be treated with metronidazole or vancomycin. Rationale. Antibiotics can disrupt the normal gut flora, leading to C. difficile overgrowth. Symptoms like diarrhea and fever indicate a potential infection, requiring prompt treatment with appropriate antibiotics like metronidazole or vancomycin. Question 33. A nurse is preparing to administer insulin to a diabetic patient. The patient is experiencing signs of hypoglycemia. What should the nurse do first? A. Administer a dose of insulin as prescribed. B. Give the patient a carbohydrate snack or glucose. C. Contact the physician immediately for instructions. D. Increase the patient's intravenous fluids to hydrate. Answer. B. Give the patient a carbohydrate snack or glucose. Rationale. In cases of hypoglycemia, the first priority is to raise the patient's blood sugar level by providing carbohydrates or glucose. Administering insulin would worsen the condition. Contacting the physician and fluid administration are secondary actions. Question 34. A nurse is caring for a patient with septic shock and is preparing to administer norepinephrine. What is the most important nursing consideration? A. Infuse the medication rapidly to ensure quick vascular constriction. B. Monitor blood pressure continuously and titrate the dose as needed. C. Administer the medication without checking the patient's cardiac history. D. Ensure that the patient is adequately hydrated before administration. Answer. B. Monitor blood pressure continuously and titrate the dose as needed. Rationale. Norepinephrine is a potent vasoconstrictor, and close monitoring of the blood pressure is essential to prevent excessive vasoconstriction and organ ischemia. Adequate hydration is important, but should be balanced with careful titration of norepinephrine. Question 35. A nurse is administering vancomycin to a patient with a known history of renal dysfunction. What should be closely monitored during therapy? A. Blood pressure. B. Liver function tests. C. Renal function and serum creatinine levels. D. Serum potassium levels. Answer. C. Renal function and serum creatinine levels. Rationale. Vancomycin can be nephrotoxic, especially in patients with pre-existing renal dysfunction. Monitoring renal function and serum creatinine levels is crucial to prevent further renal impairment. Question 36. A nurse is providing discharge education to a patient recently diagnosed with tuberculosis, TB. What is the most important aspect to emphasize regarding medication adherence? A. Discontinue treatment if symptoms improve. B. Take the prescribed medications exactly as ordered, even if feeling better. C. Increase the dose of the medication if symptoms do not improve. D. Skip doses occasionally to avoid side effects. Answer. B. Take the prescribed medications exactly as ordered, even if feeling better. Rationale. TB treatment involve a long course of medication, and it is critical that the patient completes the entire regimen as prescribed to avoid resistance and relapse, even if symptoms improve. Question 37. A nurse is caring for a patient who is receiving antibiotics for a severe bacterial infection. Which action is the most important to prevent the development of antibiotic resistance? A. Administer antibiotics only when absolutely necessary and as prescribed. B. Educate the patient to stop taking the antibiotic as soon as they feel better. C. Increase the dose if the patient is not showing improvement. D. Provide additional antibiotics to the patient for future use. Answer. A. Administer antibiotics only when absolutely necessary and as prescribed. Rationale. Overuse and misuse of antibiotics contribute to antibiotic resistance. The nurse should ensure that antibiotics are administered only when necessary and that the patient completes the full course as prescribed. Question 38. A patient with a central venous catheter, CVC, develops redness and swelling at the insertion site. What is the most appropriate nursing intervention? A. Apply a cold compress to reduce swelling. B. Continue monitoring the site and document the findings. C. Remove the catheter immediately and notify the healthcare provider. D. Administer a dose of antibiotics to prevent infection. Answer. C. Remove the catheter immediately and notify the healthcare provider. Rationale. Redness and swelling at the CVC site suggest a possible infection or thrombophlebitis. The catheter should be removed to prevent further complications, and the healthcare provider should be notified for further management. Question 39. A nurse is caring for a patient receiving multiple medications, including a diuretic and an ACE inhibitor. What should the nurse monitor closely to prevent potential adverse effects? A. Serum sodium and potassium levels. B. Blood glucose levels. C. Cardiac rhythm. D. Liver enzyme levels. Answer. A. Serum sodium and potassium levels. Rationale. Diuretics and ACE inhibitors can affect electrolyte balance, especially potassium. Close monitoring of serum sodium and potassium levels is crucial to avoid complications like hypokalemia or hyperkalemia. Question 40. A nurse is preparing to administer a blood transfusion to a patient with anemia. What is the first step before administering the blood? A. Verify the patient's identity and blood compatibility with the blood bank. B. Start an intravenous infusion of normal saline. C. Administer a dose of acetaminophen to prevent a transfusion reaction. D. Premedicate the patient with antihistamines. Answer. A. Verify the patient's identity and blood compatibility with the blood bank. Rationale. Verifying the patient's identity and ensuring blood compatibility are critical to preventing a transfusion reaction. Starting an IV, administering medications, or pre-medicating should not occur before this verification. Question 41. A nurse is caring for a patient in the intensive care unit who has a catheter-associated urinary tract infection (CAUTI). What is the most important nursing intervention to prevent further infection? A. Replace the urinary catheter every 24 hours. B. Ensure strict hand hygiene and aseptic technique during catheter care. C. Administer antibiotics immediately after catheter removal. D. Maintain a closed urinary drainage system and avoid frequent catheter changes. Answer. B. Ensure strict hand hygiene and aseptic technique during catheter care. Rationale. Strict hand hygiene and aseptic technique during catheter care are the most important interventions to prevent CAUTI. Frequent catheter changes are not recommended unless clinically indicated. Question 42. A nurse is administering warfarin to a patient who has recently undergone surgery. What is the most critical monitoring parameter? A. Platelet count. B. International Normalized Ratio, INR. C. Hemoglobin levels. D. Prothrombin time, PT. Answer: B. International Normalized Ratio, INR. Rationale: INR is the critical measure for monitoring warfarin therapy. It ensures that the patient is within the therapeutic range and reduces the risk of bleeding or clotting. While PT and platelet count are important, INR is the primary monitoring tool for warfarin therapy. Question 43. A patient is receiving intravenous morphine for severe pain management. The nurse observes that the patient is becoming increasingly lethargic and their respiratory rate has decreased. What is the nurse's immediate action? A. Increase the morphine dose to control the pain. B. Administer naloxone Narcan and monitor the patient's vital signs. C. Decrease the morphine dose and continue monitoring. D. Contact the physician for further orders. Answer: B. Administer naloxone Narcan and monitor the patient's vital signs. Rationale: decreased respiratory rate and lethargy are signs of opioid overdose. Naloxone Narcan should be administered to reverse the effects of morphine, and the patient's vital signs should be closely monitored. Question 44. A patient receiving broad-spectrum antibiotics develops a secondary yeast infection. What is the nurse's most appropriate intervention? A. Continue the antibiotics and offer oral antifungal treatment. B. Stop the antibiotics and initiate antifungal therapy immediately. C. Assess for other signs of infection and monitor the patient's symptoms. D. Switch the patient to a narrow-spectrum antibiotic. Answer: A. Continue the antibiotics and offer oral antifungal treatment. Rationale: antibiotics often disrupt the normal microbial balance, leading to secondary yeast infections. The antibiotics should be continued, but antifungal therapy should be added to treat the yeast infection. Question 45. A nurse is caring for a patient who is receiving high-dose steroids for an autoimmune disorder. What is the most important nursing consideration for preventing complications? A. Monitor the patient for signs of hyperglycemia and hypertension. B. Restrict the patient's sodium intake to prevent fluid retention. C. Administer a calcium supplement to prevent bone loss. D. Ensure the patient receives prophylactic antibiotics for infection prevention. Answer: A. Monitor the patient for signs of hyperglycemia and hypertension. Rationale: high-dose steroids can cause hyperglycemia and hypertension, making it essential to monitor for these complications. While calcium supplementation and sodium restriction are important, blood pressure and glucose management are the most immediate concerns. Question 46. A nurse is caring for a postoperative patient with a history of deep vein thrombosis, DVT. What is the most important intervention to prevent complications related to DVT? A. Encourage early ambulation and leg exercises. B. Administer anticoagulants as prescribed. C. Apply compression stockings to both legs. D. Provide adequate hydration to maintain circulation. Answer: A. Encourage early ambulation and leg exercises. Rationale: early ambulation and leg exercises are the most effective ways to prevent DVT complications. While anticoagulants, compression stockings, and hydration are important, mobility is the most critical intervention. Question 47. A nurse is caring for a patient with a pressure ulcer. What is the most important factor in preventing further deterioration of the wound? A. Ensure the patient is repositioned every 2 hours. B. Apply an occlusive dressing to the wound. C. Provide high-protein nutritional supplements. D. Administer pain medications before dressing changes. Answer: A. Ensure the patient is repositioned every 2 hours. Rationale: frequent repositioning is key in preventing pressure ulcers from worsening by reducing sustained pressure on vulnerable areas. Nutrition and pain management are also important, but repositioning is the most critical step in wound care. Question 48. A patient who has undergone a hip replacement is prescribed enoxaparin for deep vein thrombosis prophylaxis. What is the most important aspect of monitoring the patient during therapy? A. Monitoring platelet count for thrombocytopenia. B. Monitoring for signs of bleeding, especially at injection sites. C. Checking liver function tests regularly. D. Administering additional doses if the patient is immobile. Answer: B. Monitoring for signs of bleeding, especially at injection sites. Rationale: enoxaparin is an anticoagulant, and bleeding is the most serious potential complication. The nurse should monitor for signs of bleeding, especially at injection sites, and adjust the dose as needed. Question 49. A nurse is caring for a patient with a central line. What is the most effective way to prevent catheter-related bloodstream infections, CRBSIs? A. Use a single lumen catheter for all patients. B. Perform strict hand hygiene before accessing the catheter. C. Replace the catheter every 72 hours. D. Use antiseptic wipes before each catheter access. Answer: B. Perform strict hand hygiene before accessing the catheter. Rationale: hand hygiene is the most effective strategy to prevent CRBSIs. While using antiseptic wipes and catheter care are important, proper hand hygiene before accessing the catheter is crucial in preventing infection. Question 50. A nurse is caring for a patient who has just been started on antibiotics for a urinary tract infection, UTI. What is the most important intervention to promote adherence to the prescribed treatment? A. Explain the importance of completing the entire course of antibiotics. B. Monitor the patient for adverse reactions to the antibiotics. C. Provide the patient with a pain reliever to manage symptoms. D. Encourage the patient to drink plenty of fluids. Answer: A. Explain the importance of completing the entire course of antibiotics. Rationale: educating the patient on the importance of completing the full course of antibiotics is critical to preventing resistance and ensuring the infection is fully treated. Other interventions, such as pain relief and hydration, support symptom management but do not directly promote adherence. Question 51. Which of the following drugs used to treat tuberculosis can cause hepatotoxicity? A. Rifampin. B. Isoniazid. C. Ethambutol. D. Pyrazinamide. Answer: B. Isoniazid. Rationale: isoniazid is known to cause hepatotoxicity, especially when used for prolonged periods. Rifampin can also have liver effects, but isoniazid is more strongly associated with liver damage. Question 52. A patient on antiretroviral therapy, ART, for HIV complains of feeling nauseated and dizzy. Which drug is most likely causing these side effects? A. Zidovudine AZT. B. Efavirenz. C. Tenofovir. D. Lopinavir. Answer: B. Efavirenz. Rationale: Efavirenz is known to cause CNS side effects, including nausea, dizziness, and vivid dreams. It is a common side effect associated with non-nucleoside reverse transcriptase inhibitors, NNRTIs. Question 53. What is a common side effect of the tuberculosis drug rifampin? A. Renal failure. B. Orange discoloration of body fluids. C. Severe diarrhea. D. Hearing loss. Answer: B. Orange discoloration of body fluids. Rationale: rifampin can cause orange or red discoloration of urine, sweat, and tears, which is harmless, but should be communicated to patients. Question 54. Which of the following is the primary side effect associated with the HIV drug indinavir? A. Nephrolithiasis, kidney stones. B. Hyperglycemia. C. Peripheral neuropathy. D. Skin rashes. Answer: A. Nephrolithiasis, kidney stones. Rationale: indinavir, a protease inhibitor, is associated with the formation of kidney stones and requires careful monitoring of renal function. Question 55. A child diagnosed with mumps has been prescribed acetaminophen. What is the primary concern regarding the use of acetaminophen in this case? A. Risk of gastrointestinal bleeding. B. Risk of liver damage due to overdosage. C. Increased risk of kidney failure. D. Drowsiness and sedation. Answer: B. Risk of liver damage due to overdosage. Rationale: acetaminophen overdose can lead to liver damage, especially in children. It is crucial to avoid exceeding the prescribed dose to prevent hepatotoxicity. Question 56. Which HIV drug class is most likely to cause bone marrow suppression? A. Protease inhibitors. B. Nucleoside reverse transcriptase inhibitors, NRTIs. C. Non-nucleoside reverse transcriptase inhibitors, NNRTIs. D. Integrase inhibitors. Answer: B. Nucleoside reverse transcriptase inhibitors, NRTIs. Rationale: NRTIs such as zidovudine are known to cause bone marrow suppression, leading to anemia and neutropenia. Question 57. What is the most common side effect of the tuberculosis drug ethambutol? A. Vision changes. B. Hearing loss. C. Nausea and vomiting. D. Jaundice. Answer: A. Vision changes. Rationale: ethambutol can cause optic neuritis, leading to vision changes such as blurred vision or color blindness. Regular eye exams are recommended during therapy. Question 58. A patient on antiretroviral therapy reports feeling fatigued, muscle weakness, and joint pain. Which of the following medications is most likely responsible for these symptoms? A. Efavirenz. B. Stavudine. C. Zidovudine. D. Abacavir. Answer: C. Zidovudine. Rationale: zidovudine is associated with side effects such as anemia, fatigue, muscle weakness, and joint pain due to its effects on bone marrow and hematopoiesis. Question 59. What is the most common side effect of the measles vaccine? A. Rash at the injection site. B. Fever and mild rash 7 to 10 days after vaccination. C. Severe allergic reaction. D. Nausea and vomiting. Answer: B. Fever and mild rash 7 to 10 days after vaccination. Rationale: fever and a mild rash occurring 7 to 10 days after the measles vaccine are common side effects. Severe reactions are rare. Question 60. A patient taking rifampin for tuberculosis reports a yellowish tint to their skin and eyes. What is the most likely cause of these symptoms? A. Hepatitis caused by the medication. B. Allergic reaction to the drug. C. Vitamin A deficiency. D. Bilirubin buildup due to liver damage. Answer: A. Hepatitis caused by the medication. Rationale: rifampin can cause liver damage leading to hepatitis, which can result in jaundice, yellowing of the skin and eyes. Question 61. A patient diagnosed with HIV is taking antiretroviral therapy. Which drug combination is most likely to cause gastrointestinal side effects, including diarrhea and nausea? A. Tenofovir, emtricitabine, and efavirenz. B. zidovudine, lamivudine, and abacavir. C. Atazanavir, ritonavir, and lopinavir. D. Nevirapine, zidovudine, and didanosine. Answer: A. Tenofovir, emtricitabine, and efavirenz. Rationale: this combination is known for gastrointestinal side effects such as nausea and diarrhea, which are common with many HIV regimens. Question 62. A 5-year-old child is diagnosed with mumps and is prescribed ibuprofen. What should the nurse monitor closely due to potential side effects? A. Liver function. B. Renal function and hydration status. C. Blood glucose levels. D. Respiratory rate. Answer: B. Renal function and hydration status. Rationale: ibuprofen can affect renal function, especially in young children, and dehydration can exacerbate these effects. Question 63. Which side effect is most commonly associated with the HIV drug lamivudine? A. Hepatitis. B. Lactic acidosis. C. Peripheral neuropathy. D. Insomnia. Answer: B. Lactic acidosis. Rationale: lamivudine is associated with a rare but serious side effect of lactic acidosis, especially in patients with pre-existing liver disease. Question 64. A patient receiving tuberculosis treatment with rifampin and isoniazid develops peripheral neuropathy. What is the most appropriate intervention? A. Discontinue both drugs immediately. B. Administer pyridoxine, vitamin B6, to prevent further neuropathy. C. Switch the patient to second-line tuberculosis medications. D. Increase the dose of isoniazid. Answer: B. Administer pyridoxine, vitamin B6, to prevent further neuropathy. Rationale: isoniazid can cause peripheral neuropathy, and pyridoxine is given to prevent this side effect, particularly in high-risk patients. Question 65. A patient is receiving zidovudine for HIV treatment and reports fatigue and dizziness. What is the most likely cause of these symptoms? A. Anemia due to bone marrow suppression. B. Hypotension from dehydration. C. Hepatotoxicity from the drug. D. Hyperkalemia from the drug. Answer: A. Anemia due to bone marrow suppression. Rationale: zidovudine can cause bone marrow suppression, leading to anemia and resulting in symptoms like fatigue and dizziness. Question 66. Which of the following is a potential side effect of the rubella vaccine? A. High fever and severe allergic reaction. B. Rash and mild fever 7 to 10 days post-vaccination. C. Severe joint pain and swelling. D. Gastrointestinal distress. Answer: B. Rash and mild fever 7 to 10 days post-vaccination. Rationale: a mild fever and rash occurring 7 to 10 days after receiving the rubella vaccine are common and expected side effects. Question 67. What is the primary adverse effect of the HIV drug stavudine that nurses should monitor? A. Peripheral neuropathy. B. Liver toxicity. C. Nausea and vomiting. D. Skin rashes. Answer: A. Peripheral neuropathy. Rationale: stavudine is known to cause peripheral neuropathy, a common and potentially serious side effect, requiring close monitoring. Question 68. A child with a history of measles presents with a cough, rash, and high fever. What is the most important intervention to prevent complications? A. Administering corticosteroids to reduce inflammation. B. Providing fluids and supportive care. C. Administering antibiotics to prevent secondary bacterial infections. D. Initiating antiviral treatment immediately. Answer: B. Providing fluids and supportive care. Rationale: supportive care, including hydration and fever management, is the primary intervention for measles. Antibiotics or antivirals are not used to treat viral infections like measles. Question 69. A patient with HIV is receiving a regimen that includes protease inhibitors. What is the most significant side effect to monitor for? A. Hyperlipidemia and insulin resistance. B. Rash and fever. C. Severe abdominal pain. D. Thrombocytopenia. Answer: A. Hyperlipidemia and insulin resistance. Rationale: protease inhibitors are known to cause metabolic side effects, including hyperlipidemia and insulin resistance, which require monitoring. Question 70. A patient with HIV who is on a combination therapy regimen complains of a persistent rash. Which of the following drugs is most likely responsible? A. Efavirenz. B. Tenofovir. C. Zidovudine. D. Lopinavir. Answer: A. Efavirenz. Rationale: Efavirenz, a non-nucleoside reverse transcriptase inhibitor, NNRTI, is commonly associated with skin rashes, particularly early in treatment. Question 71. A 12-month-old child is receiving the measles, mumps, rubella, MMR vaccine. What is a common expected side effect? A. Severe anaphylactic reaction. B. Mild fever and rash. C. Seizures due to fever. D. Diarrhea and vomiting. Answer: B. Mild fever and rash. Rationale: mild fever and a rash are common side effects of the MMR vaccine, occurring around 7 to 10 days after vaccination. Question 72. Which of the following is a common adverse effect of the HIV medication nevirapine? A. Hemolytic anemia. B. Severe liver toxicity. C. Nephrotoxicity. D. Insomnia and nightmares. Answer: B. Severe liver toxicity. Rationale: nevirapine is associated with hepatotoxicity, including severe liver damage, and requires regular liver function monitoring. Question 73. A patient with tuberculosis on combination therapy complains of joint pain and stiffness. Which drug is most likely causing these symptoms? A. Isoniazid. B. Rifampin. C. Pyrazinamide. D. Ethambutol. Answer: C. Pyrazinamide. Rationale: pyrazinamide can cause joint pain and stiffness, especially in the initial stages of treatment. It is a common side effect of this tuberculosis drug. Question 74. A nurse is monitoring a patient receiving rifampin and isoniazid for tuberculosis. Which lab result is most important to monitor during therapy? A. Serum calcium levels. B. Liver function tests, LFTs. C. Blood glucose levels. D. Platelet count. Answer: B. Liver function tests, LFTs. Rationale: rifampin and isoniazid can both cause liver toxicity, so it is important to monitor liver function through LFTs during therapy. Question 75. A pregnant woman at 32 weeks gestation presents with severe abdominal pain, nausea, and vomiting. She is hypotensive with a raised liver enzyme level. What is the most likely diagnosis? A. Acute appendicitis. B. Ectopic pregnancy. C. HELLP syndrome. D. Gallbladder disease. Answer: C. HELLP syndrome. Rationale: HELLP syndrome, hemolysis, elevated liver enzymes, low platelets, is a severe form of preeclampsia and can cause abdominal pain, nausea, vomiting, and liver dysfunction, particularly in the third trimester. It requires immediate intervention to prevent maternal and fetal complications. Question 76. A woman with a history of preterm labor at 28 weeks is admitted for observation. The nurse assesses regular uterine contractions, 5 minutes apart. What is the first priority in management? A. Administering magnesium sulfate to stop contractions. B. Administering a corticosteroid to enhance fetal lung maturity. C. Hydrating the patient to prevent dehydration-induced contractions. D. Performing a cervical exam to check for dilation. Answer. B. Administering a corticosteroid to enhance fetal lung maturity. Rationale. In preterm labor, administering corticosteroids is the priority to promote fetal lung maturity. While magnesium sulfate and hydration are part of the management, the immediate focus should be on preparing the fetus for potential preterm birth. Question 77. A pregnant patient presents with persistent headache, visual disturbances, and upper abdominal pain at 36 weeks gestation. What condition should the nurse suspect? A. Preeclampsia. B. Acute pancreatitis. C. Gestational diabetes. D. Hyperemesis gravidarum. Answer. A. Preeclampsia. Rationale. Preeclampsia is characterized by high blood pressure and can present with symptoms like headaches, visual disturbances, and upper abdominal pain. It is a critical condition that can lead to maternal and fetal complications, requiring immediate medical attention. Question 78. A woman who is 20 weeks pregnant presents with painless vaginal bleeding. On ultrasound, the placenta is low-lying. What is the most appropriate management? A. Immediate cesarean section. B. Bed rest and pelvic rest. C. Routine ultrasound in 2 weeks. D. Administering magnesium sulfate. Answer. B. Bed rest and pelvic rest. Rationale. A low-lying placenta can cause bleeding, but if the bleeding is painless and not excessive, conservative management like bed rest and pelvic rest is indicated. A cesarean is only indicated if the placenta previa persists later in pregnancy or if there is significant bleeding. Question 79. A postpartum patient develops a fever, tachycardia, and a foul-smelling lochia discharge on day 3 after delivery. What is the most likely diagnosis? A. Postpartum depression. B. Endometritis. C. Mastitis. D. Urinary tract infection. Answer. B. Endometritis. Rationale. Endometritis is an infection of the uterine lining, typically presenting with fever, tachycardia, and foul-smelling lochia in the postpartum period. It requires prompt antibiotic therapy to prevent complications such as septic shock. Question 80. A 25-year-old pregnant woman at 12 weeks gestation is diagnosed with hyperthyroidism. What is the safest management strategy during pregnancy? A. Administering radioactive iodine. B. Surgery to remove the thyroid gland. C. Antithyroid drugs like propylthiouracil, PTU, during the first trimester. D. Levothyroxine therapy. Answer. C. Antithyroid drugs like propylthiouracil, PTU, during the first trimester. Rationale. Propylthiouracil, PTU, is preferred in the first trimester of pregnancy for managing hyperthyroidism due to its lower risk of causing birth defects. Radioactive iodine and thyroidectomy are contraindicated during pregnancy. Levothyroxine is used for hypothyroidism, not hyperthyroidism. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.